Hi, and thanks for joining us today on Your Oral Health. Thanks also to your local cable access television network for giving us the privilege of bringing this to you. Local cable television is your television. It's your friends, it's your neighbors, it's your resource. So support it whenever you can. While you were away, Mary Ann was so stimulated by the program that she managed to nap in spite of our clever banter. Hopefully you've gotten the gist of the importance and the ability of you as a parent or a guardian or someone responsible for a child's dental health, that you can do some of these analysis and cleanings in your own home, in the comfort of your own home. We talked a little bit about the importance, and this is a perfect example of it, of establishing a rapport between the child and the dentist. That's real important. The child needs to be comfortable with the dentist, needs to look forward to that experience, and that only happens by training them at a young age. Steve, we talked a little bit about, too, the emphasis in all of the dental practices that we know about, the importance of prevention. We talked about fluoride as being a real front to preventive decay. We talked a little bit about diet and its importance in the role of decay. What other kinds of preventive things do you find are helpful and that you use in your pediatric dental practice?
Well, certainly the early intervention aspects that we talked about, and most parents, what are they concerned about when they take their child to the dentist? And it's usually the first question they'll ask after the dental exam is, do they have any cavities? So tooth decay is probably still one of the most prevalent diseases known to man that we find in the world.
Let me just ask, in your experience now, which is 15 years, is the incidence of decay in our particular patient population starting to decrease?
Absolutely. So our efforts in prevention are working. I tell parents that as far as dental decay is concerned, it's not preventable totally. It's something that we can control. And the things that we've talked about in ways of controlling it are bringing their child early to the dentist to demonstrate good oral hygiene techniques. And these techniques will incorporate the concepts of removing dental plaque, which contain the bacteria which causes tooth decay, which in itself is an infection. So we're removing the plaque or the infection to help that child or prevent that child from getting tooth decay. And we've already talked about the use of fluorides. Another way for us to try to prevent tooth decay is by physically providing a barrier that goes over the tooth that prevents the bacterial plaque from accumulating and incorporating itself into the tooth itself.
So this is the baby teeth as well as the permanent teeth?
Well, predominantly we do it in the permanent teeth. It can be done in the baby teeth as well. So this physical barrier we call sealants. And we tell children we're going to paint a coating on their teeth to make their teeth stronger. The coating, however, is only incorporated over the chewing surfaces of the molars primarily. The chewing surfaces of the molars are responsible for about 2/3 of all tooth decay. So we're really hitting a significant portion of the disease concept by sealing those areas.
Is it correct to say that the predominance of dental decay might be on those surfaces?
Absolutely.
And therefore appropriate to seal them?
Absolutely. And as we say, it's predominantly done on the permanent teeth, although we do use it on primary teeth in children that are at high risk.
Primary teeth, excuse me, just by definition, would again be baby teeth. A more technical term would be deciduous teeth, primary being first, secondary teeth being the permanent teeth. So when we say baby teeth, we're talking about primary teeth.
And being a technique-sensitive procedure, it's very difficult oftentimes to do it on an uncooperative child to place the sealants.
Steve, the incidence of sealants has grown considerably. The success of them has. Do you find that sealants will last a lifetime limited, or do they stay in the tooth till adulthood? What happens if a sealant needs to be replaced? Do they ever have to be replaced?
They certainly do. There's nothing permanent in what we can do in that regard. And what we're finding now is that many general dentists are often offering sealants for adults. So it is a procedure that's becoming more universally accepted.
So a sealant might be appropriate for someone as young as me, I almost said old as me, as well as a child, again, as a preventive mechanism.
It may. The concept of using sealants, however, in a pediatric population is to get the child through the cavity, quote, prone years. which is oftentimes in early childhood, let's say from ages 6 and through adolescence.
Young patients that are seen in a general restorative dental practice, where the patients might be of various ages, what type of a patient might be more appropriate, if that's the right term, to be seen in your pediatric dental practice as opposed to a restorative sort of general family dental practice?
Well, what we find is our practice philosophy and approach is geared specifically and just to children. When you walk in our dental office, the office is designed for children. It's very children-friendly. And everybody who works in our office is all geared towards communicating effectively with children and making the environment and the experience as children-friendly as possible. So we are a general pediatric practice, which means we see all children. We also see many children who are referred to us with special needs. And special needs may be just basic dental needs, as well as children with medical problems, as well as developmental disabilities. And we see a very wide range of children just like that.
So the physical plant and office setting is more conducive and comfortable for a younger patient population?
It really is. The choice of colors, the open concept that we use. Open concept meaning that our clinical area is open and people can see visually. We use a lot of outside lighting, natural lighting, to make the area much more cozy and comfortable, as well as the choice of colors that we use. Our design in what we put on our walls, as far as a choice of paintings and posters, the toys are everywhere. A child can feel comfortable coming into that setting.
Pretty much like your living room, I guess.
I think so. Actually, I sort of have balanced it with sort of a child going to a child care setting, where many children today are taken care of in a preschool setting or a nursery school setting. Very, very similar to that.
I've been to Steve's office. It's all of that. It really is a patient-friendly, child-friendly kind of a place. It's real kind of comfortable to be there. I kind of sort of hate to leave. There's a lot of things going on, and it's kind of fun. Making dental choices can be difficult. We'd like to help. If you'd like a free brochure entitled Dental Decisions, Making the Right Choices, published by the American Dental Association, you can call us at 1-800-SAY-SMILE, that's 1-800-729-7645, or write us at Your Oral Health, Box 915, Hanover, New Hampshire, 03755. In the last segment of our program, we're here with Dr. Stephen Bachner, pediatric dentist. We'd like to talk about the all-too-common injuries to young children's teeth. Children have a tendency during their toddler ages to fall a fair amount. Oftentimes the first thing that hits is their teeth or their face, lips. Might hit themselves on a coffee table. Actually, this is a decaffeinated coffee table. I've got a special for this segment. That's my dental joke. Steve, tell us about the incidents and how we at home as parents, again, caregivers to children, this is important for daycare people, too, who may be running daycare centers, have young children in their home. What happens? A child walks, falls, hits, bang?
Absolutely, Fred. You're right on. We see many, many toddlers who are falling, and they're beginning to walk. Oftentimes they have shoes that don't fit. Usually they're too big because parents want to have them grow into them. So combined with the ill-fitting shoes many times, and many times just learning how to walk, they oftentimes do fall. Fortunately, most of the time the distance they fall isn't very far. However, we've seen many injuries where they have fallen great distances. When walkers were very popular, going downstairs was a very major problem that I used to see, particularly when I was a dental resident, and occasionally here in the Upper Valley at the medical center. So it is a very common problem. Many times we'll pick up this problem on routine exams when a child comes in, when we take dental x-rays, when we evaluate the front teeth and front jaw area for just a general survey. We'll oftentimes pick up suggestions of early trauma.
What suggestion might you give to the viewers? They're at home, it's 7 o'clock at night, the child has tripped over the rug, fallen, hit their face, there's bleeding, there's fear, the child's upset, the adult is upset. What kind of suggestions can you get them to walk through this?
Well, absolutely. Again, probably the parent as upset, if not more upset than the child. What goes through the parent's mind is all these things, how I ruined this child's teeth, and their smile's not going to be the same, and so forth. What you want to do is do the best you can to get under control, and many of the techniques that we talked about earlier in evaluating or examining your own child's mouth will be very helpful at this point. However, many times a child is quite out of control. It's important just to get them under control and then assess the situation. There are generally no major areas that will cause significant bleeding, but oftentimes there is bleeding, and you want to stop the bleeding, and you want to get the area cleaned off of blood so you can actually see what's going on. Many times putting ice on the lip will help after that time, or just give the child a popsicle. That oftentimes will be soothing.
Sugar-free popsicle.
Which would be very soothing and can help them. And then what you probably should do is call your pediatric dentist or a dentist to ask some questions, and they can better ask you over the telephone what you see and whether the child should be seen right then. But we oftentimes do recommend the child be seen so that the injury can be evaluated to determine future problems.
So it's pretty much trying to sort of gather your wits first and then the child's, and that, again, depending on the magnitude of the fall, it's usually a fair amount of show, but oftentimes not very severe irreversible damage. But it's not appropriate for the parent or the caregiver to make that decision necessarily. They might want to get some expert advice at the appropriate time.
Many times the injuries do not require immediate attention, and there are times that they do. And clearly those are times that hopefully the right questions will be asked of the parent to determine whether that's needed.
A lot of times you'll hear parents say they had a fall, now the tooth is turning black. Can you just quickly sort of tell us what that means? Not in the biological sense, but a black tooth may not be attractive, but doesn't necessarily mean that there'll be other problems as a result.
Again, early evaluation can put into context what a darkened tooth means. And generally during those visits we tell the parent that. Especially dark teeth right after an injury is not necessarily a bad situation.
Okay. I want to thank my guest, Dr. Stephen Bachner, for being with us today. Steve, it's always a pleasure to talk
Same here, Fred. It was
with you.
really fun.
We have not enough time to do this in our busy lives, and I'm grateful that you spent the time with us this morning. Thanks
Thank you.
again.
Thank you.